As a healthcare practitioner and from personal experience, I know one of the hardest parts of cancer journey is the uncertainty, wondering if a treatment will actually work for you. That's where the RGCC Greek test comes in, analyzing circulating tumor cells in your blood. It shows us which therapies your unique cancer cells respond to. In this video, I'm going to walk you through how the test works, how we use it in our practice, and what it can mean for patients facing cancers like breast, prostate, and colon. Hi, I'm Dr. Gez Agolli, and today we're going to explore the Greek test and its impactful insight during the cancer journey. Cancer is never just a medical condition. It's deeply personal. Having walked through it with someone close to me, I understand how important it is to have clarity and hope in the middle of uncertainty. The Greek test gives us a powerful way to personalize care, reduce the guesswork, and help patients feel confident about their path forward. Cancer is on the rise. According to the NIH, CTC, all of these agencies are reporting over 2 million Americans are going to be diagnosed with cancer. Some of the most common forms of cancer are breast cancer for women. Unfortunately, we're seeing a rise in breast cancer. So I implore all women out there to have regular breast screenings. You can have self-breast examinations. You can talk to your physician practitioner about regular screenings. Obviously, the standard of care is mammography, although from a functional integrative perspective, we also believe that there are some new technologies out there. One of them is called thermography, and your practitioner may not know about that, but it's published research, and they're looking at the thermal aspects of your breast. Also, we know that ultrasounds are useful depending on your physician, whatever they find with the mammogram. We also see that there's beneficial studies with MRIs. I know that's a little more expensive, but that is the gold standard. And if it's something that you feel it's important, if you have a history of breast cancer, definitely ask your practitioner about these diagnostic tests that are available. There's also the liquid biopsy. There's a lot of good tests out there. One of them is called the RGCC OncoDeclare, and the OncoDeclare also will be able to tell you if you have any circulating tumor cells in your system, and then you can talk to your practitioner about ordering that test as well. There's another great test called the Gallery test, and that's also a blood test, and that's going to be looking at the DNA. So these are great tests or screening tools. Certainly talk to your practitioner. At Progressive Medical, we believe in being proactive rather than being reactive. The second leading cause of cancer in the United States is unfortunately prostate cancer. So men, be proactive and ask your practitioner to check for your PSA. But it's a screening tool that if it's elevated will alert your physician to either do a biopsy or further testing. And once again, you can go ahead, if your PSA is elevated, ask your practitioner about some of these other screening tests called the Gallery or the RGCC OncoDeclare. Third leading cause of cancer that we're seeing right now are colorectal cancer. That's on the rise. The American Medical Association is constantly researching and making recommendations. I believe it's over 45 years old. It used to be over 50. Really, depending on your family history, you should probably consider doing a colonoscopy. There are some other tests that you can do as well that are non-invasive. Cologuard is one of those. But the message here is this: cancer's on the rise. Be proactive, be vigilant. Testing is critically important. If you don't test, you just guess. So let's not wait too long. Let's be proactive. Early detection saves lives. That's the message here at Progressive Medical. There's many ways to do that. Talk to your doctor, talk to your practitioner, look at all these advancements. Liquid biopsies on the rise. It's fantastic. But before you do that, do your scans, do your regular checkups, and talk to your practitioner, talk to your family doctor, and don't do it till it's too late. At Progressive, our practitioners utilize the RGCC test. We use the OncoTrace to monitor treatment, circulating tumor cells, which is a liquid biopsy, so that's an advantage right there. And the Onconomics Plus actually is a measuring the amount of circulating tumor cells, but also will let our practitioners know the advancement of your cancer, how aggressive it is. It's going to measure sensitivity on what treatments work, and the goal is to help our practitioner determine the best course of treatment by blocking these circulating tumor cells. Unfortunately, cancer actually hijacks different parts of the body. It can hijack something called the mitochondria. It could be a glucose pathway, which we know that glycolysis And we know also there's a glutamine pathway. So we're looking to block the circulating tumor cells from advancing, and that could be with traditional chemotherapies. This test actually measures traditional chemotherapies, what's sensitive for your cancer. We utilize it at Progressive Medical, looking at all the other natural components of it. Is your cancer sensitive to high-dose vitamin C? Is your cancer sensitive to curcumin? Is it sensitive to something called resveratrol? Even measures ivermectin, looking at all kinds of different areas, something called oxaloacetate and something called DCA. All of these areas are so important to individualize. The message here for RGCC, the Onconomics Plus, it individualizes your care and helps you win this battle and focusing on recovery, whether you're deciding to use just traditional, whether you do integrative or natural. That is the empowerment this test will give you, the patient, as you're battling cancer. And we can use it in all different ways. Some of the success stories that we've seen here, patients have come in and they had been battling cancer for a period of time. And they've said, well, I've done high dose vitamin C. I've done all these different supplements. And one of our practitioners orders the test and they realize the vitamin C is not sensitive. So now it's so individualized, it'll tell you the best course of action. And that is the great thing about this test, is that it's very individualized, not just protocol driven. So that's why we like using the Onconomics Plus RGCC and also the OncoTrace, which measures how the treatments are doing within a 3, 6, 9, and 12-month interval. It's all about helping you get to the root cause and help you win your battle with cancer. If you found this video helpful, please give it a like and subscribe more educational content on integrative and regenerative therapies. I'd love to hear your thoughts. Share your questions or experiences in the comments below. Sometimes the most powerful support comes from conversations like these. This is your life. Live it well.